Depression is a mood disorder which feelings of sadness, loss, anger, and frustration interfere with everyday life for weeks or longer. The use of cognitive behavioral therapy may help treat depression, which could lead to a better life. The purpose of this study is to examine the problem of depression in young women who are either pregnant and or parenting and living on the streets, and the effects of the use of cognitive behavioral therapy in treating their condition. This population of adolescents come out of abusive homes, either physically or sexually, have had little schooling, often use drugs, and many times are involved in illegal activities. Shuffled through the foster care system, they are unable to embrace a stable home environment and turn to living on the streets. Frequently, these girls become pregnant. Now living in extreme poverty and without support networks, it is not surprising that this lifestyle can lead to major depression. It is important for social workers to understand the needs of these young mothers and how to treat the depression that arises from their living situation. The rates for depression are extremely high within this population of mothers. Treating through the use of CBT may help these young mothers regain their confidence and self-esteem and help to create a better lifestyle for themselves and their children. This study will show that CBT can be a successful treatment option for depression among adolescents, among ethnic teens, and among pregnant and parenting young women. But there is not enough evidence yet to support this. While there are 12% of women from all socioeconomic backgrounds that suffer from depression, it is at 25% for those living in poverty and for racial and ethnic minorities. Depression in Homeless Mothers, Addressing an Unrecognized Public Health Issue, written by Ellen Bassick and William Beardsley, is the most up-to-date study which examines a variety of preventative and therapeutic interventions among low-income and homeless mothers. It concludes that very few of these approaches have been adapted for use in this homeless population. The review of We Care, a randomized control trial which provides documentation data of the effectiveness of medication and cognitive behavioral therapy provided to this population. An additional randomized control trial conducted for 1 year was also reviewed, and it concluded that medication and CBT decreased depression in almost half of the sample, but medication may have had a slightly stronger effect due to difficulty of gaining consistent access to the teens. The Treatment for Adolescents with Depression study, TADS, was found to be the cornerstone for most research done on young people with major depressive disorder. A short-term and long-term effectiveness of 4 treatment options were examined. This is pharmacological intervention, CBT, CBT combined with antidepressant medication, and clinical management with a placebo. The conclusion to this study in regard to the CBT in treating depression in adolescents is that a combination of the therapy treatment along with antidepressant medication is more effective than either treatment alone. A review by Maura Delaney called A Critical Evaluation of the Role of Cognitive Behavioral Therapy in Children and Adolescents with Depression provides an interesting perspective on the research conducted for depression in this adolescent population. This is a substantial evaluation in which it hypothesizes if CBT alone could ever be an effective treatment option within this population. And the study shows that CBT alone is not as effective as CBT plus an antidepressant medication. Psychological treatments for perinatal depression is an additional study that was reviewed, and this is based on the perinatal depression and its treatments. This demonstrates that the use of CBT has its benefits. This study is important to note in regard to the teen homeless population because it tells us that engagement and retention in treatment are particularly challenging for pregnant women who suffer depression. The purpose of this article is to review and compare psychotherapy modalities and medication and how they will affect depression in women at the time of birth. The internet and telephone-based delivery modalities were used and have shown increased popularity, but its true effectiveness needs further research. This is an important element to examine within the teen mom homeless population and keeping them engaged. More research is also needed on the therapy formats such as group and individual, as well as the high-risk populations, those with social and economic challenges. Effects of cognitive behavioral school-based group intervention with Mexican American pregnant and parenting adolescents is a social work study which experiments using cognitive behavioral therapy within a school-based group intervention program for a specific population of Mexican American girls who are pregnant and parenting. This was a randomized experimental study using pre- and post-tests with a 30-day follow-up. The outcome of this study shows that there is great success in implementing CBT within this specific population. Will cognitive behavioral therapy reduce depression in homeless, pregnant, and parenting teens? The dependent variable is depression, and the independent variable is CBT. An A-B design will be used. There will be 3 weeks of baseline measurements prior to the intervention, and then there will be a final measure taken after the intervention is completed. The intervention of CBT will be implemented on a weekly basis for 1-hour sessions for a 12-week period of time. This evidence-based treatment will include ways in which to improve on problem-solving techniques, learning better coping skills, and attempt to outline a cogent, sensible plan to move forward after the treatment. The sample population intended for the study are a group of young women ages 21 and younger who are either pregnant or parenting and currently experiencing homelessness. Data will be collected during the first 3 weeks to establish baseline, and then upon the completion of the 12-week therapy sessions. Additional information will be gathered during the hour-long sessions of the treatment period. The Depression, Anxiety, and Stress Scale will be used to measure the subject's depression. DAS-21 is a shortened self-report scale designed to measure the negative effects of depression, anxiety, and stress. DAS-42 is the longer version. A shorter version is used here to keep subjects engaged. It may be necessary to develop a simplified version of DAS in the future to avoid such difficulties. This may increase the reliability and validity. This may be a future implication for social work research and practice. Little research has been conducted on adolescents using the DAS-21. It is expected at the completion of this study involving the implementation of CBT on an adolescent population of homeless, pregnant, and their parenting girls that the effects of depression will be lessened but may not be significant. There is not enough prior research conducted on this population to know for certain that it will be an effective treatment. The limitations of the study may be due to the fact that homeless populations of pregnant and or parenting teens is a difficult group to locate and contact. It is challenging to engage them in any kind of study because of their home instability. It may also be hard for a researcher to get the subjects to consistently attend weekly therapy sessions as well as participate in any of the follow-ups. There may also be feelings of mistrust of any outsider given their possible abusive backgrounds with other adults, and they may not answer truthfully. There is a lot of research to show that CBT can be a good treatment for depression, and it will continue to be important to this study and its use in the management of depression in teens. But with this specific population, there has not been enough research conducted to say with certainty that it will be the acceptable and successful treatment option in this single subject design.